Welcome back. Because aspirin is so commonly used in our daily life, you also need to know pharmacokinetics of aspirin. This drug can be administered orally. Its absorption is very rapid, and aspirin can distribute widely in the body. It is mainly metabolized in the liver, but the liver has a limitation to metabolize aspirin. When aspirin is used lower than 1 gram in a day, is linear elimination. It's the first order kinetics. Half-life is a constant. It's about 2 to 3 hours. But when the drug dose is more than 1 gram, it exceeds the body limitation of elimination. So at these conditions, it's the zero-order kinetics, non-linearity elimination. Half-life is not half a constant anymore. It's about 15 to 30 hours. With the dose increase, half-life is prolonged. Aspirin, it is one acidic drug. It is excreted with the urine from kidney. Because it is acidic drug, so its secretion can be influenced by urine pH value. Actually, aspirin has been used for more than 100 years. Its pharmacological effect and adverse effects are much clearer. Because it is so commonly used, so these adverse effects, you should master them very well. It includes gastrointestinal reactions, blood coagulation drawback, Reye's syndrome. Actually, it is hypotoxicity, hypersensitivity, including aspirin asthma, and salicylate intoxication, and renal injury. Let's study one by one in detail. GI tract reaction. It is the most common reaction caused by aspirin. It has a latency to induce or aggravate ulcer. Actually, this adverse reaction on GI tract is mostly caused by direct stimulation after oral administration. So, aspirin enteric-coated tablets are more popular, and you also can suggest the patients to take aspirin with meals. Try to decrease this local irritation in the mucosa of stomach. And another reason is because of inhibition COX-1 in the mucosa of stomach. Because aspirin is mechanism of action is inhibit the synthesis of prostaglandins in different area, different size. In the mucosa of the stomach, this prostaglandins is PGE2. This substance has a protective significance for the stomach in mucosa. So once it is also inhibited to produce PGE2, the protective function for the mucosa of the stomach, it also is reduced by aspirin. So sometimes it is necessary to suggest the patients to use aspirin with misoprostol. Misoprostol, it is an analog of prostaglandins. Try to prevent peptic ulcer. And because of these adverse effects on the GI tract, it also related to antiplatelet reactions, actually bleeding or hemorrhage of stomach, it is relatively common and dangerous. Try to avoid it. The second adverse effects of aspirin is blood and blood coagulation drawback. Because many patients require aspirin in low dose to prevent thrombosis formation, try to decrease the risk of cardiac vascular events. But antiplatelet effects caused by aspirin in low dose. It, one hand, inhibits the thrombosis formation. At the other hand, it also inhibits hemostasis when it is necessary. So it can increase bleeding time, decreases platelet adhesiveness, and aggregation. So for the patients, if they need a surgery, suggest them stop 1 week, at least 1 week, prior to surgery to avoid the bleeding complication. Because, this antiplatelet reactions, it is irreversible, and the platelet has no nuclear. This function recover requires a new platelet production. So, because lifespan of a platelet, it is about 7 to 14 days. So stop at least 1 week prior to surgery to avoid bleeding complication. And some individuals, when they use aspirin at large dose, may cause hypoprosthrombemia. For this problem, coagulation, it is relatively difficult. Maybe vitamin K, it is useful for this. The third adverse effect of aspirin is hepatotoxicity. Hepatotoxicity includes 2 forms. One form is dose-dependent. The patients with connective tissue disorders. Another form, it is hepatic injury. It is caused by Reye's syndrome and usually occurs in children. This Reye's syndrome, although it is rare, but it is fatal. It is characterized by fulminant hepatitis and cerebral edema in children. It usually caused by administration of aspirin after a viral infection, such as chickenpox and influenza. Because these 2 kinds of viral infection, fever is so common symptom. It's very common symptom of this disease. And aspirin, it is used to relieve fever. It's very effective. But because, I mentioned, the liver has a limitation to metabolize aspirin. For the children or teenagers, their body development is not enough. So metabolism of aspirin, it also is not enough. So for the children and teenagers under 20 years old, they should not use aspirin in viral infection, to treat fever. It actually had better not use aspirin to relieve fever in children. Try to avoid these serious adverse effects. Hypersensitivity caused by aspirin occurs approximately 50% of patients. The symptoms like rhinitis, urticaria, and bronchial asthma to laryngeal edema, hypotension, even shock. This is the allergic reactions to aspirin. This bronchial asthma, if it is caused by aspirin, it also caused by aspirin asthma. The mechanism of this hypersensitivity is because aspirin moves arachidonic acid metabolism to leukotrienes and other products in lipoxygenase pathway. Now, remember this? Arachidonic acid has two pathways to metabolize. One is to produce prostaglandins. Another way is leukotriene. But when nonsteroidal anti-inflammatory drugs inhibit COX, this pathway is blocked. So there are more arachidonic acid metabolized to leukotriene to produce leukotriene. So this is a mediator of allergic reactions. So the patients has more incidence of hypersensitivity. Now, remember this terminology. It is caused by aspirin asthma. Some individuals, after using aspirin, they have bronchial asthma because aspirin increases the leukotriene production. So try to know how to state that aspirin asthma. Next adverse effect caused by aspirin is salicylate intoxication. Actually, aspirin, after absorption in the body, they convert into salicylate. So this intoxication caused by salicylate intoxication. It usually occurs it usually caused by overdose. It is a mild salicylate intoxication. Symptoms include nausea, vomiting, headache, dizziness, tinnitus, deafness, sweating, and mental confusion. Actually, it is a salicylism. Or maybe tinnitus, this word. It means noise in the ear. The symptoms of more severe intoxication include hyperventilation, fever, restlessness, even ketosis. Once the patients have these symptoms, it often warns you there is a salicylate intoxication. So try to take some measure to rescue the patient's life. First one is withdraw at once. And the next one, more important, is intravenous injection sodium bicarbonate to increase the pH value of the urine and then promote the excretion of aspirin. Remember, I mentioned aspirin, it is one acidic drug. So increase pH value of urine by intravenous injection of sodium bicarbonate. It can promote excretion of aspirin because of air trapping. Remember that? Next adverse effects of aspirin is renal injury. Actually, on normal kidney, it has no obvious effects. But for old people or patients with problem on the heart, liver, or kidney, maybe it can cause edema and diuresis. Because in the kidney, it also have COX. It is COX-1. This aspirin also inhibits that COX and then inhibits the synthesis of prostaglandins E1 and I2 in the kidney. Finally, it can affect renal hemodynamics and water and salt balance. Okay, here there are 6 points of adverse effects of aspirin. Maybe it is not very easy for you to memorize. So there is a tips to help you to remember. Aspirin. So these adverse effects caused by aspirin include aspirin asthma. It is one kind of hypersensitivity. And the salicylate intoxication. It usually caused by overdose of aspirin, exceed 5 grams in a day. And peptic ulcer. It means gastrointestinal reactions. Intestinal gastric bleeding, it caused by antiplatelet effect, antithrombotic action. This is blood coagulation drawback. And Reyes syndrome. It is one hepatotoxicity in children. So don't use aspirin to relieve fever in children. Injury of kidneys and noise. Just now I mentioned this is the meaning, this word, tinnitus. It just occurs at high doses. It is one sign of salicylate intoxication. Okay, that's all for this section. So how about the other non-steroidal anti-inflammatory drugs? Yeah, aspirin, it is the representative drug in these families, but there are more agents to substitute its antipyretic and anti-inflammatory effect. But only antiplatelet effect cannot be replaced by the other agents. But I should mention this. Other non-steroidal anti-inflammatory drugs cannot used to prevent to decrease the risk of cardiovascular events, but they can, when they used together with aspirin, they can also increase the blood bleeding time. Yeah, when they used alone, it also can increase blood bleeding time. You should understand this. Let's go on. Non-steroidal anti-inflammatory drugs include many agents with different chemical structure. Acetaminophen and phenacetin. Acetaminophen is the active metabolite of phenacetin, responsible for its analgesic effect. It is a weak prostaglandin inhibitor in peripheral tissues and possesses no significant anti-inflammatory effects. Acetaminophen is one of the most important drugs used for the treatment of mild to moderate pain. Pain and fever is so common symptoms of many diseases. It is very common used in our daily life. Phenacetin, it is more toxic and has no rational indications. But acetaminophen, in the treatment of pain and fever, it is more popular than aspirin. Acetaminophen has another name, paracetamol, and sometimes it also caused by Panadol. In Chinese, it is called 扑热息痛. It means this 扑热 means relieve fever. 息痛 means relieved pain. That's why it is commonly used for the relief of fever and pain. because its antipyretic and analgesic effect is similar to aspirin, but it has no anti-inflammation and effects on platelet function. It is mostly used for the treatment of headache and fever. Its adverse reactions compared with aspirin is relatively mild, but it also induces allergic reactions, nausea, and vomiting. Once it is used in overdose, it also has hepatic damage because the metabolism of acetaminophen, similar to aspirin, is also in the liver, and the liver metabolism function to acetaminophen, it also has limitation. Allergic reactions is also relatively has more incidence, like this picture show. A woman, after she has used acetaminophen to treat pain during menstruation. It has a regular erythema on the shoulder. This is one allergic reaction caused by acetaminophen. Although this is relatively safe, so actually this drug, it is very common used in our daily life. Here in China, these compounds that used to treat cold contain acetaminophen. And because it is safer than that of aspirin, so in the treatment of fever in children, it is very common used. But this drug, although it is safe, but the body elimination to acetaminophen still has limitation. Usually, the dose should lower than 2 grams in a day. So actually, because this drug is so widely used, and there are so many compounds that are used to treat cold contain this substance. So this year, the latest revised instruction for acetaminophen by China State Drug Administration, there are some changes. This drug can induce serious adverse effects on skin, allergic reactions. And when it is used in overdose, it also induces serious hepatic injury. So this instruction suggests in a day, the dosage of acetaminophen don't exceed 2 grams. And also don't use this drug in combination with some other compounds, including acetaminophen. Once intoxication caused by acetaminophen diagnosed, use this specific antidote, N-acetylcysteine, as soon as possible. Acetic acid derivatives, indomethacin. This drug is an indole derivative. It has anti-inflammatory, antipyretic, and analgesic effects. These effects are remarkable. Actually, it is one of the most potent COX inhibitors, so it also has more adverse effects. Because it is very potent anti-inflammatory drugs, it is usually used in the treatment of rheumatoid arthritis, stiffness of osteoarthritis. But it is very potent drugs say as adverse reactions also is relatively severe. It also has cross-relatability with aspirin. Ibuprofen. This drug, it also is available over the counter and widely used in our daily life. It is one propionic acid derivatives. In a day, 2,400 mg of ibuprofen has a similar effect of anti-inflammatory effects as 4 gram aspirin. So it means it is more potent than aspirin. It also can be administered orally in lower dose used to treat pain, but has no anti-inflammatory efficacy. So in our daily life, it is commonly used to treat rheumatoid arthritis and other inflammatory joint conditions. Deglofinite. This agent is one relatively new non-steroidal anti-inflammatory drug. It is more potent even than indomethacin. Its analgesic, anti-inflammation, and antipyretic effects is about 26 to 50 folds of aspirin. So actually, in the treatment of arthritis, it also is more popular in the patients with arthritis. But actually, it also has relatively more adverse effects. And the latest revised instructions for deglofinite by state drug administration include this drug also induces serious allergic reactions, including allergic shock. Even it also occur collapse and hypotension in the patients. So just use this drug for a short term, don't for a long term. Salicylate. It is one selective COX-2 inhibitor. Because COX-2 is a inducible COX, much more related to inflammation. So compared with non-selective COX inhibitors, Salicylate has relatively less adverse effects related to COX-1. The incidence of gastric toxicity is much lower than non-selective COX inhibitors. It is widely used to treat osteoarthritis and rheumatoid arthritis. Like this picture shows, the patient has this rheumatoid arthritis. But because it also has an inhibition on the COX in endothelium cells, so it has problems with cardiovascular system, cardiovascular safety. So for the patients with cardiovascular disease, do not use this Salicylate. Try to prevent the risk of cardiovascular events. This is opposite to aspirin. Okay, that's all for this chapter. I also give you several questions. Include aspirin's pharmacological effects and therapeutic applications. These effects include 5 points, and applications, include various pain to relieve fever, diagnose acute rheumatoid fever, used to treat arthritis. Yeah, it requires a relatively large dose, and used in the cardiovascular application to prevent thrombosis and used to treat Kawasaki disease. Don't forget that. Adverse effects of aspirin include 6 points. Do you remember? GI tract reactions, blood coagulation drawback, hypersensitivity, hepatotoxicity, including Reye's syndrome, salicylate intoxication, and renal injury. Try to remember them very well, okay? And can you fill in this blank? The antipyretic and anti-inflammatory effects of non-steroidal anti-inflammatory drugs are primarily due to inhibition of prostaglandin synthesis by inhibiting COX. Okay, these drugs you have studied in this chapter, they usually used to relieve fever. You try to distinguish them from chlorpromazine. And they also used to treat some inflammation. Try to distinguish them from glucocorticoids. And they also used to treat pain. So try to distinguish atropine and morphine. You know, these two drugs also used to relieve some pain. Atropine used to relieve some pain related to smooth muscle spasm. And morphine, you know, to treat some severe pain, you usually choose morphine. For mild to moderate pain, we often choose aspirin or others, and NSAIDs. Okay, that's all for this chapter. You will study diuretics in the next chapter. That's all. Thank you.